People will often ask me, can hair be transplanted into scars? And the answer, in short, is yes, but there are certain nuances, so let's review them here. The summary of this video is that we're going to first review a new study on transplanting hair follicles into scar. This literally just came out like a week ago. We're going to go over scenarios where you'd consider transplanting into scars, and we'll also review some clinical pearls related to transplanting hair into scars. Now, the study that was published this month in Nature Regenerative Medicine had the following hypothesis: that anagen hair follicles can remodel mature scar tissue towards a healthy phenotype. So what they're saying basically is, can hair that's transplanted into a scar actually make the scar look better? Not just because it has hair in it, but because it completely changes in that now the hair is there and it becomes a healthier type of skin. So it moves away from being like a ugly scar to healthier looking skin. That was their hypothesis. Now, the method was 3mm full thickness punch biopsies of the scars that were done before the hair transplant and then at 2, 4, and 6 months after the hair transplant in a total of 3 patients. So this was like a smaller pilot study. The patients all had mature normotrophic scars that were at least 4 years old, and they were formed post-surgically on the back of the head from prior FUT or strip surgeries. Now, these were the findings of the study in terms of changes in mature scars. They found after the hair transplant that there was an increase in the epidermal thickness, an increase in interdigitation of the epidermal dermal junction, and this was likely due to stem cell activity by the hair follicle. They also found an increase in dermal cell density and vessel density, likely caused by the secretion of remodeling growth factors from the transplanted hair follicles. And they found an inhibition of pro-fibrotic cytokines. This included TGF-beta, IL-13, and IL-6. So things that normally cause an increase of scar tissue were actually inhibited because of the hair being transplanted into the scars. Now, the ultimate goal of the researchers was not to increase the popularity of hair transplants. Rather, it was to use this as a model to study the remodeling of fibrotic tissue in order to find therapies that can be used for any type of fibrotic tissue, not just skin. Now, let's go over some clinical scenarios. Scars in and around hair-bearing areas have various etiologies. The first would be like an FUT scar. So similar to the study where patients have had prior hair transplant surgery where an entire strip was excised and that hair was then transplanted to other parts of the scalp, presumably. So those FUT scars live along the back of the head and they're very linear and they bother people. And there are different ways to deal with them. If the scar is rather large and thick, it can sometimes be revised surgically by removing the scar and then resuturing and hoping for a thinner scar. Even then, you still have a linear scar. So then your options would be either some scalp micropigmentation into the scar or potentially doing an FUE hair transplant where you extract randomly some grafts from the back of the head and you transplant them along the scar. So that is something that we do in the practice, and that is one way to deal with some old FUT scars. Another scenario is a facelift or a brow lift that was previously done. When patients get a facelift, some of those incisions come very close and essentially into the hairline. Now, those scars will usually heal well if the facelift is performed well, but in some patients they leave a more visible scar, and in some patients they just don't heal great, so they have this type of scar right at the hairline. One way to deal with that is to very carefully place grafts into the scar at the proper time point once the scar is more mature. And the important thing with that type of placement is you need to observe the proper angulation of the hair because it's right usually at the temple, and that angle is fairly acute, so you can't place the hairs kind of coming out of the face. It needs to run along the natural temple and sideburn hair projection. The other scenario would be like a brow lift. So if you had a brow lift and the incision was made at the hairline or behind the hairline, some patients get this area of alopecia. It could be from the scar itself or some shock loss that occurred around where the incision was placed, and so those sites can also be transplanted transplanted. Another scenario would be burn scars. When patients get subjected to various burns around hair-bearing areas, it can leave a complete lack of any hair growth, and so those sites can often be transplanted with pretty good success. Another scenario would be a trauma scar. So if someone had a traumatic accident such as a motor vehicle accident, they might be left with certain scars, say around the scalp, and those scars can also be transplanted. Another scenario, you've got post-cancer removal and reconstruction cases that also leave scars. Some patients even get like split thickness skin grafts to cover up different defects. Those can also be transplanted with overall good success rates. And lastly, I wanted to mention here that there are areas other than the scalp where we would consider doing a hair transplant after various types of scarring. So that could mean some facial types of hair transplants. So if someone has a scar around the eyebrow or around the beard area in a man, or say they lost some underarm hair or some pubic hair, and those are all areas where you can potentially do a hair transplant to try to improve the overall condition of it. Now let's go over some considerations of doing a hair transplant into scars. The first is that there is a limited blood supply in the scars. So the degree of blood supply present will actually dictate the survival of the grafts. Not all scars are created equal. So some scars are quite dense and thick and lack blood supply. Others have very good vascularity. That's going to change how readily a graft survives in that scar. The next point is that the density of hair transplanted into the scar should be reduced compared to non-scarred areas, given that the blood supply is more limited. So for example, the number of grafts per square centimeter can be about 50% to 75% fewer than when, say, you recreate a natural hairline or you're working on more normal skin. Also, larger grafts of 2 to 4 hairs tend to survive better in scar tissue compared to single hair grafts because they just have more overall blood supply to be able to anchor to. Another thing to keep in mind is that the recipient sites should be made deep enough to pass through the scar tissue into the underlying vasculature to improve graft survival. And when I do these types of procedures, the way I know that it will likely be a pretty good result is when we start making the recipient sites. If we're seeing that the overall bleeding rate is good, we actually consider that a good thing because that means that there's good vascularity to the area, as opposed to when you're making sites and there's just no bleeding at all. That is more concerning. I also wanted to point out that there's an increased rate of popping during graft placement given the rigidity of the tissue. And what that means is that as you're placing the graft in, sometimes the neighboring graft that you recently placed could actually pop out, so it has to be replaced. That could of course slow down the pace of the hair transplant. Now let's review some clinical pearls when it comes to transplanting into scars. Sometimes it's better to actually surgically revise a scar that is too wide or too deep or misplaced before transplanting into that scar. Also, not all scars are the same, as I mentioned previously, so graft survival will be better in thinner, shallower scars compared to thicker and deeper scars. And that also goes to show you that there's a lack of predictability when we're transplanting into scars. We always tell patients that the overall survival will be lower than transplanting into healthier skin. It's best to let scars mature for at least 6 months prior to performing a hair transplant into them. You want the overall inflammatory activity to settle out before you go right in with a hair transplant, again to increase the potential of survivability. Fat transfer with or without PRP, which is platelet-rich plasma, into a scar to essentially bring in stem cells and growth factors prior to a hair transplant may in fact improve survival rates, and there are a few studies in the literature to support that. Also keep in mind that scalp micropigmentation, which we have a video on, might be an option for scars in certain areas if a patient, let's say, is not interested in a hair transplant, or maybe is just not a candidate for a hair transplant. For example, maybe they have a limited donor supply. So SMP becomes a viable option for many of those patients. So in summary, you can have a hair transplant into a scar, but you need to keep all of these nuances in mind when signing up for a procedure like that. Make sure to subscribe to our channel and turn on all notifications. Since you enjoyed this video on hair transplants into scars, please make sure to check out our entire hair transplant series to learn more.